Hello everyone, welcome back to my channel. I hope each one of you is doing really good. And so now today we'll talk about oral contraceptive pills. So there are so many doubts ladies have on oral contraceptive pills, which they are using for the 21-day cycle course for either spacing or for other medical issues like polycystic ovarian disease, or prior to infertility, taking care of their menstrual cycles, for planning pregnancy. This is which oral contraceptive pill to take. Actually, in the market we have a variety of range with a combination of estrogen and progesterone. So estrogen is the component which is either available in the form of ethinyl estradiol in the dosage, different formulations. Estrogen comes in the form of 20 microgram, 30 microgram or 50 microgram. Mostly we are using 20 and 30. And then there is a progesterone component of it. And the progesterone component, there are different varieties, or you can say different generations of progesterone which we have, according to which we have different generations of oral contraceptive pills. As you can see above, you have the one with ethinyl estradiol combination and cyproterone acetate. You have ethinyl estradiol with combination of risperidone. You have ethinyl estradiol combination with levonorgestrel. You have ethinyl estradiol combination with norgestrel, and also you have ethinyl estradiol combination with desogestrel. So, next question arises, what is the role of the oral contraceptive pill? So how are they useful to us? So for women, actually oral contraceptive pill is not just for contraception. They have multitude of other uses. So we are familiar that it is used for the 21 days cycle, and every 21 days after that you have 7 days a gap where you can have the withdrawal bleeding, and again you can start in the next cycle for 21 days. So this is how you want to space your children if you have children, and also if you want to delay your pregnancy, so you can plan your pregnancy once you quit taking these oral contraceptive pills. Besides this, there are uses of oral contraceptive pills in the following. So you have polycystic ovarian disease to regularize your periods. Then you have it used in acne, and the combination of cyproterone acetate and drospirenone, where they are basically anti-androgens as well. Then you have it useful in case of planning or scheduling your pregnancy prior to your periods. Like if a patient has heavy menstrual bleeding, we give only progesterone first, and sometimes we give a combination of estrogen and progesterone. So there also it plays a role. So coming to the third question, the pill, if used, how will it act? How they act is they prevent, one is ovulation by a negative feedback mechanism of LH surge and hence ovulation. So besides this, you have progesterone. Okay, so the progesterone, it basically causes the cervical mucus to get thickened. So again, it prevents the movement of the sperm through the female genital tract, and it prevents fertilization. So one is it prevents ovulation, and second is prevents fertilization. So hence, how will the pregnancy occur? Fourth question arises that how do we have to take it? So it is very important for a lady to take it in a proper way and not miss the doses, so that to get a full 100% success or 100% guarantee that there will be no pregnancy during the cycle. So for this, what she has to do is she has to start the pill, the first tablet of the pill, on the day 1 of her periods, and she can do that till the 5th day of her periods. Okay, from day 1 to day 5 she can start any time, but it is advisable to start early as possible. And second, she has to keep in mind that she does not have to miss a single dose also. Third, if she takes the pill, she should take preferably at night after eating her meals, so that there's a fixed pattern to it, because obviously whenever you take a pill, you should be compliant, and you should remember you should take it the next day at the same time. So question number 5 comes, what happens if I forget to take the pill? So there are various concerns which arise if you miss the pill. So if the first thing is if you miss a single pill. So if you miss a single pill, it is not going to matter much. The day you remember, if you remember the next day, the next morning, just take it. And the next scheduled dose of the pill is to be taken as when it was to be taken. Second, if you miss 2 pills, so what you do is you have to take two pills whenever you remember. Like suppose if I missed yesterday and I'm remembering it today morning, so I'll take those two pills today, and then the scheduled dose is to be taken today as well. Okay, when you miss more than two pills in a cycle. So if you miss more than two pills in a cycle, it is advisable for you to actually stop that pack. Okay, take the dose that day and then stop that pack and then start a fresh pack again. And also use a contraception protection in the form of a physical barrier like a condom for the next 7 days. Why is this very important? Because whenever you take the oral contraceptive pills, whenever you start them in a cycle, after 7 days it takes time for the pill to show its action. Okay. Point number 6 is, what is the failure rate of oral contraceptive pills? So basically the oral contraceptive pills have a failure rate if they are used very effectively in the manner which I told you in the initial part. They can be as successful as 99.9%. Okay, so it is just 0.1 to 0.3% could be the failure rate. Point number 7, what are the side effects of oral contraceptive pills? Okay, so this is to be very clear that oral contraceptive pills, when taken more than 3 months to 6 months, they start showing side effects. Okay, but initially once you start taking the pill, there can be the following side effects like nausea, vomiting, there can be just spotting. Okay, and once you take it more than 3 months, you might notice these symptoms as well, like headache, bloating, water retention. And bloating and water retention together can make you feel heavy and overweight. Other side effects can be breast tenderness. Point number 8, how long can a woman take oral contraceptive pills? It is safe for a lady to take oral contraceptive pills for postponing pregnancy or for spacing her childbirth for as long as 2 years, and that is considered safe. And point number 9, there's a common question asked to me by so many young teenagers when I prescribe this drug for PCOS or for acne, that is this contraception going to affect my childbirth? Is it going to affect me getting pregnant? So there's a big no to that. It does not alter your pregnancy chances, or it does not take a toll on your fertility. And then once you quit it, so within a 1 month range, your hormones come back to the normal and you can plan your pregnancy again. So that's absolutely safe for you to use. So what are the contraindications of using oral contraceptive pills? Following conditions: moderate to severe hypertension, liver disease, the gallbladder disease, history of smoking, and there's migraine with aura, obesity, hyperlipidemia, embolic phenomena in the past, history of stroke, history of cardiovascular events. So that was all about oral contraceptive pills. And I must tell you that the various combinations available in the market are safe. So if you have a 20 microgram or a 30 microgram combination with any of the progesterones, each of them are used in different fashion. So you have to go to a doctor and take them after a prescription. These can't be taken over the counter as they can prove counterproductive. And do comment in the section below and tell me what other kind of videos you want me to talk about. Do subscribe to my channel, guys, please.